And here's the key, I think. So the Quakers in York, England in the late 1700s said, first of all, was humble. We don't know what is wrong, but we know these people are brethren. We are all like each other. And so they said, what do we all want? And they said, well, we need shelter, we need good food, we need companionship, we need meaning, that sort of thing. And so the idea was that a retreat out in nature, because nature was seen as also part of an environment that could be healing, that time and a supportive environment, one that did provide these basics of shelter, meaning, good food, respect towards the person, a sense of agency for the other person, could in fact lead people back to recovery. Now, the York retreat opened in 1796. It was a small house out in the nature in York, England. It still exists today, by the way. And this was the idea. You should be kind, you should treat people as brethren. And the thought was this too. People who came here had a God-given capacity to recover, so it wasn't a sort of pessimistic thing. And even if people couldn't recover, the Quakers had an obligation to provide an environment that was as supportive and as kind as possible. And their results were this, because they did do outcome results. They found that 70% of those who had been ill less than 12 months before coming to the retreat recovered and did not relapse into illness. And even of those who had been chronically ill, treated in asylums like Bedlam, 25% recovered and then were able to go back into the community. And by the way, when historians have gone back and looked at patient records of people treated, say, at the York Retreat or the early moral treatment asylums in the United States, these people were, quote, disturbed. It wasn't that there was a milder form of people coming to these places. These people would have otherwise been in, the psychiatric hospitals of the day, asylums of the day. In Worcester, Mass, there was a big study of all patients admitted from 1833 to 1846. And of 984 patients admitted during those 13 years, 58% recovered and remained well throughout their lives. And this was like a 35-year follow-up. 7% relapsed, but subsequently recovered and returned to the community. 35% become chronically ill. So what do you see again? About a recovery rate of about 2/3. Pennsylvania Hospital was another place that really had a moral therapy approach for a number of years during the 1800s. And they had a big study that looked at 8,546 patients treated from 1841 to 1882. And here were their outcomes, their collective outcomes during that 40-year period. 45% were discharged as cured, 25% were discharged as improved. Now, of course, they were being discharged into societies. There was no social safety net. So people had to go back to work. They obviously had to be in families, that sort of thing. So there's obviously a level of functionality happening when we're talking about people returning to the community.